Hello, welcome to Blindside Fresno. My name is Darcy Elliott, and we're happy you're here today to be part of our first program. We hope that Blindside Fresno will become a regular feature and that it will bring you news about issues within the blind and visually impaired community. We also hope it will help you with advice about how to take care of your eyes and your vision. We are very pleased today to welcome Dr. Vivian Kim as our guest. She is a very well-respected retinal specialist here in Fresno and has an incredible resume. Apart from being educated at Yale, Tulane, University of Pennsylvania's Shea Eye Institute, and Tufts Eye Center, she managed to earn a master's degree in public health. In her spare time, she is a classical pianist, an amateur photographer, and a competitive ballroom dancer. I don't know when she has time to sleep, but we are honored she has carved out some time for us today. Thank you and welcome, Dr. Kim.
Thank you, Darcy. I really appreciate the opportunity to come and speak on behalf of Blindside Fresno.
Thank you. So we're so glad you're here today. Why don't you share with us a little bit about how you got into the field of ophthalmology and retinology?
Well, I chose ophthalmology because, well, I've always had a love for medicine as a little girl. I remember reading my father's medical textbooks when he was studying for his board examination, and I was fascinated. But why ophthalmology? I think ultimately I wanted to combine my love of the visual and do something that was primary care in the sense of taking care of some basic important function, and also my love of surgery. So I think ophthalmology encompassed all of that.
So it offered you a lot of challenges.
Sure does, technically with surgery, and just also the challenge of taking care of something that's so important to us, our vision.
Before we talk about specific eye diseases today, why don't you give us a little review of eye anatomy for those of us who can't remember their high school biology?
Okay, so here's a model of the eye that's been sliced in half right through the middle, and then when you turn it to the side, you can see the actual inside of the eye. Okay. So if you imagine a light ray passing straight through the cornea into the eye and hitting the back wall, the light rays pass through the clear dome, which we call the cornea, and then it passes through the lens, which is the condensing lens. It actually bends the light rays and refracts them so they can focus on then what accepts the light rays and translate those light rays into vision, which is the retina. It's a neural tissue that lines the back wall of the eye, and you can see that it encompasses about 2/3 of the inner wall of the eye. And all those impulses from the retina then are carried through to the optic nerve, which is right here, to the brain, where the brain translates it into vision.
Okay, so it is a bit of a complicated process, and there are several things that could go wrong along the way. And specifically, some of those diseases that affect us here around the world, but here in the Valley as well, is the first one is diabetic retinopathy. And what causes that? What is the preventions for that? What can you tell us about diabetic retinopathy?
Okay, I guess the first thing, even before we start to talk about any of these diseases, I kind of want to tell you a story about my mother.
Okay.
My mother actually used to think that she had a lot of problems with her teeth, and she thought that when your teeth fell out or you lost a tooth, that it was a natural part of aging. And then what she ultimately had to realize, and I was able to explain to her after I'd gone to medical school, was that actually when your teeth fall out, it is not actually a natural part of aging. It's because there's a problem in the tooth, whether it's gingivitis or an abscess or an infection that makes you lose your teeth. So in the same way, I think the public sometimes has this perception that vision problems are a result of age. And we can't help aging. All of us are destined and programmed to age.
Right.
But the eye in and of itself, if everything went okay and we didn't develop any particular disease of the eye, even into our 90s and 100, we should be able to see well and have good vision and enjoy the benefits of good vision. So if we look at the diseases, some diseases, let's say diabetic retinopathy that you just mentioned. Diabetes is a disease that affects millions of Americans, in fact about 28 million at the last census taking. That's a lot of diabetes, and it's becoming an epidemic because of the actually increase in obesity. Obesity is becoming an epidemic in America, and obesity creates insulin resistance, which leads to increased levels of type 2 diabetes.
Okay.
There's also type 1 diabetes, which is mostly genetically driven, and which means that the body doesn't actually produce enough insulin for the body. So there's two different mechanisms, but the end result is diabetes, which is high glucose in the bloodstream. But let's talk about the diabetes in the eye. So if we look at the model of the eye again, you can see that there's blood vessels traveling in this orange, which I said is the retina, which is the lining in the back wall. So the eye is one of the few places that we have the privilege of actually gazing on the blood vessels directly. So it's like the eyes being
The window to the soul.
That's right. So we actually get to see the health of the blood vessels by looking at the retina and examining the retina. And since diabetes is considered primarily a vascular disease because it affects the vasculature and the blood vessels of the whole body, not just the eyes, we get to see it though in the retina directly by gazing into the eye. So when it affects the blood vessels in the eye, we call that diabetic retinopathy because those blood vessels run in the retina.
Okay.
So the important thing to know about diabetic retinopathy is that there can be many changes that happen to the blood vessels, but you can still maintain excellent vision. You can have 20/20 vision and have lots of changes and lots of damaging happening that you are not aware of if you are looking out of your own eyes and enjoying good vision. That's one of the important things I think that the public needs to be aware of. The second issue is that it's important to understand, and I'm sure all the diabetics have heard this from their doctors, is that the most important thing that they can do to control the onset or the progression of diabetic retinopathy is glucose control.
Right.
There's two factors. We have time with diabetes, and you have level of glucose control. The first one, most of us can't control because when we get diabetes, if it's based on our genetics, we really don't have that control over that. But we do have control over glucose control.
Right.
So that is the take-home message or the important message for the public and anybody with diabetes to understand is that they have that in their control.
Okay. And it was interesting that you said that people might not even be aware of changes in their vision. So it's really important to have that tested if you have diabetes.
Right. So
Would you say even more often than the once a year or just once a year or?
For sure to begin with, annual screening exams are important. After that, if there's any level of retinopathy or any findings, then the doctor will determine what the appropriate level of follow-up would be.
Okay, and what would some of the treatments for retinopathy be? Because once you have it, it's not really reversible, right?
That's true. Okay, so since the 1970s, the gold standard treatment actually based on multiple studies and clinical studies was the laser. So that used to be the gold standard. We'd do laser to cauterize leaking blood vessels, and then we would do laser actually to obliterate actually major areas in the retina to stop the development of abnormal blood vessels, which is one of the changes that can happen with advanced diabetic retinopathy. This is called proliferative diabetic retinopathy.
Okay.
Now, in the last probably 3-4 years, the FDA has approved the use of an injectable drug called anti-VEGF drugs. VEGF stands for vascular endothelial growth factor. And this has created a paradigm shift in what the gold standard treatment now is for diabetes. Because for diabetes and diabetic macular edema, the anti-VEGF treatments, which are delivered as a shot in the eye, has now caused not only preservation of vision and stopping the decline in vision, but it's actually brought an increase and return of better vision to patients who have lost the vision from changes. And then over multiple injections, couple of years of receiving drugs like this, they've actually seen a reversal in the level of retinopathy, which is unprecedented. And this has now just been discovered and seen in clinical studies over the last couple years.
So another condition that we've talked about that a lot of people suffer from is dry eye. And what can you tell us about that and the treatments for that and the causations, that kind of thing?
So dry eye doesn't sound like a very serious problem when you think your eyes are a little dry, but I can tell you from the stories that I hear from my patients that dry eyes actually can be a real bear, because nobody likes to feel discomfort or any part of their body, right? I mean, remember when we were all young and healthy that we weren't aware of any part of our body, right? So when you start to feel parts of your body that you shouldn't be feeling, there's a little bit of a problem, and it's really not fun, and it can really, this chronic discomfort that can be caused by dry eye syndrome or dry eye disease can really affect one's quality of life. So many things cause dry eyes. Believe it or not, the actual part of the eye that I didn't mention as one of the major parts of the eye is the actual tear film. The tear film coats the cornea. The cornea is very sensitized with very sensitive nerve endings that give sharp perceptions of pain if anything touches your cornea. So you get a little grain of sand in your eyelids, you feel excruciating pain. If there's a little scratch, again, excruciating pain, to the point where some people have to take narcotics.
Wow. Yeah,
so that's how sensitive the cornea is. So the job of the tear film is to actually coat the cornea to keep the surface smooth and covered. And so if anything interferes with that tear film, then you have a problem, dry eye syndrome. And the tear film itself is actually created by 3 layers. There's a mucin layer that coats the cornea. Then there's an aqueous layer in the middle, like a sandwich, and then on the outside layer, there's a lipid layer that prevents evaporation. So there's multiple purposes for these 3 layers, but the short and long, well, the short part of it, I guess, the simple part of it is that anything that affects any of these 3 layers will cause dry eye syndrome. And so the treatment and the causes are varied, and we can start with something as simple as just doing artificial tear supplementation, to doing prescription strength drugs, to doing punctal occlusion, and on and on. So there's multiple treatments, but let's just, I'm thinking about some of the causes.
A lot more complicated than, because usually I think dry eye seems pretty cut and dry, so really that needs a specialist care. Don't just suffer in silence, right? Go see someone like yourself.
Well, not a specialist, I mean, in terms of an eye specialist, yes. But I think that the message here is because there's varied causes and there's multiple approaches to treating these deficiencies that might be happening in any one of these 3 layers, there's no one quick, simple solution. So the cure or the fix is not a quick one. So I think patients need to be patient with trying the different things that will help. And it does take multiple visits to the doctor to see what's helping and what's not helping. Often in the form of eye drops or doing a punctal occlusion with little plugs that plug up the drainage site. So,
and do we know what causes it, or is it especially prevalent here in Fresno, or?
Well, one of the things causes a dry eye, of course, is your environment. So a hot, dry environment certainly is going to cause more. If you're, like if you were skiing and you're in a windy area, the wind, of course, will evaporate the tears, can cause dry eyes. And then age. So again, we're back to age. We can't stop age, right? This happens to everybody, yes. But so age alone, because the aqueous layer, the production of aqueous slows down with age, just like a lot of things. A lot of our cell turnover slows down with age. And then certain diseases like autoimmune diseases, which are predominantly seen in women over men, which is why dry eyes is seen more frequently in women. There's probably also hormonal influence, because postmenopausal women will experience this more frequently than premenopausal women. And then many things like certain drugs, anti-hypertensive drugs, antihistamine drugs can cause dry eyes. So a whole host of things. Even having refractive surgery like LASIK can cause dry eyes because it cuts on the cornea, and other procedures. And lid laxity, if the lid is not close to the eyeball because of lid laxity with aging, that also can cause some problems with the tear film.
So let's move to the third thing we have on our list is macular degeneration. And what can you tell us about that and the treatments for that? Because that's also pretty serious.
Right, so macular degeneration is called AMD, it's age-related macular degeneration. Interestingly enough, that's again, so we're talking about age again. So here we talk about, so interesting enough, it did used to be called SMD, which was senile macular degeneration, but I think now with the whole political correctness initiatives, right, senile went by the wayside and it became age-related macular degeneration. So this is a problem that affects older people, 50 and older, but it is the leading cause of blindness, believe it or not, in this age group. So everybody starts off with, there's two kinds. We have a dry macular degeneration, and when I say dry, I don't mean dry as in dry eyes. It's just another terminology for something that's happening in the retina, not on the surface of the cornea. Now we're talking about in the inside of the eye, on the retina. In fact, in the macular, so we call it macular degeneration. Macula is one location in the retina, which is right here posteriorly, right where you see this little dot, which is the dead center of the macula, called the fovea. So in this little postage stamp area where my finger is touching is predominantly where macular degeneration affects this area. So it is basically age-related. We really don't know what causes macular degeneration, other than that we know that the biggest risk factor is age, and genetics plays a huge part of it. So how we age is determined by our genes, basically, actually, how we age. So in the genetics of people that have macular degeneration, there's a propensity, and they have isolated some genes, though not all of it. Everything is known about which genes cause macular degeneration. So as part of the aging that happens, though, in the dry kind, there's actually clumps of yellow material, which they think is breakdown of cellular byproducts like photoreceptor end segments, and waste products that don't get cleared out of the eye efficiently and accumulates in the back of the eye in the retina, called in the place in the macula, and leaves clumps and starts causing disturbance of the pigment layer behind the retina called the pigment epithelium. So all this leads to drusen and atrophy, where the cells drop out and stop functioning. Just like muscle atrophy, the muscles shrink and stop working as well and are weaker. So these cells stop functioning and causes vision loss in those areas. Now, everybody starts off with dry macular degeneration, and then 20% convert to what we call the wet macular degeneration. The wet represents abnormal blood vessel complexes that start growing underneath the retina in the macula typically and cause either leaking, bleeding, exudation of cholesterol-like materials into the retina where they should not be. And that causes vision problems. It can cause scarring. The bleeding can be toxic to the photoreceptors, and distortion of the anatomy of the eye is going to cause it to not see well.
So all that sounds pretty terrible. Actually, you know, like pretty scary for a lot of people and pretty complicated. Is this one of the things that is early detection important, or is it, does that affect it at all, or?
Well, so interestingly enough, prior to 10 years ago, when I was in my training, anybody that developed wet macular degeneration, it really was pretty depressing because there really was no good treatment for the stopping of these blood vessels that were growing and leaking and causing very rapid decrease in vision, central vision. So, but about 10 years ago, there's these anti-VEGF drugs that I just mentioned for diabetic retinopathy actually were first FDA approved to be used in wet macular degeneration. And it's like a miracle. It was like the silver bullet because prior to that, there were some laser treatments, but nothing really slowed the decrease and the descent into poor vision that wet macular degeneration caused. So now we have this drug that we inject in the eye. Yes, unfortunately, it's still an injection in the eye, which people kind of have these horror nightmares about. But it's an injection that really produces amazing results because it stabilizes the blood vessels and shrinks them and stops them from leaking, and it can actually preserve vision for long periods of time so that patients can enjoy good quality of life. It used to be a death sentence to have wet, and now it's really just part of the management of a chronic disease called wet macular degeneration that involves managing it with medication.
Okay, so that's good to know. So they definitely need to take some proactive steps to take
Right.
care of that issue.
And the earlier it is, these treatments
earlier
are
the better.
started, right, the less
So
vision that we
we're back
lost.
to the annual screenings and the making
Right.
sure you take care of yourself. Okay. So
Right.
the last one that we are going to talk about today is cataracts.
Right, cataracts. I think most people have heard that term.
Right.
But what a cataract
common.
actually is
Thank you.
this is the lens of the eye,
Okay.
and normally it would be clear, but as we age again, the lens gets cloudy. So a cloudy lens is what we call cataract. So the cataract, so if you can imagine that the lens is cloudy, it's like looking through a dirty window, right? So the light waves have to pass through the lens to hit the retina, but it's going through a very dirty medium, this lens that's now cloudy. So we call that a cataract. And once it gets to a certain degree of cloudiness and affects the vision and drops the vision to a certain level where patients cannot function to the level that they want to, that's when we would recommend cataract surgery. So now let me be clear about that
Okay.
the treatment for cataracts is major eye surgery, because I get a lot of comments from patients and the public asking whether the treatment for cataracts is a laser, and it's not a laser. These days there is some technology where portions of the surgery is performed with the laser, but the surgery itself is still major eye surgery. It is curative though.
It is curative, but not to be taken lightly either.
That's correct.
And I know, just to throw a little curveball in there,
Yes.
how is that different from glaucoma? Because
Okay.
some people seem to think they're interchangeable, but they're not. They're completely
That's correct.
different.
Glaucoma is actually a different disease of the eye, and we talked about the optic nerve.
Okay.
So all the all the cells and the photoreceptors and any cells that are used in the functioning of the retina, their axons are collected and go to the optic nerve, which are then go to the brain, right?
Right.
So glaucoma affects the optic nerve. If the optic nerve is damaged, then patients are blinded, because without a nerve, you cannot see. And that's like a spinal cord injury. When the spine
regenerate
is,
nerves
you
at this
cannot
point.
regenerate it, so any damage is irreversible. And it is total, actually. In macular degeneration, because one portion of the retina is affected, it creates what we call legal blindness. Legal blindness is a terminology that's really a fabricated terminology that means that a patient can only see in their best eye 2200, which would be like if you go to an eye doctor and you've seen their eye doctor chart,
Right.
it would just be the big E on the chart.
Right.
That's legal blindness. Actually, it's the line below the big E.
Okay.
Okay, so you can see that that's one letter or two letters that you're seeing.
Right.
If you can't see better than that, that's legal blindness. But you can have plenty of peripheral vision that is served by the peripheral retina.
Right.
So macular degeneration causes legal blindness. But in glaucoma, a damage of the nerve can cause complete blindness, because without an optic nerve, you see nothing.
Right.
So that's total blindness.
Yeah, and
and
I
it's irreversible.
And in my experience, people have a misconception of saying blindness is total blindness, as opposed to there are levels.
Right.
What you can see in the distance and at what portion of your eye you can see.
Right.
So it's good to know that there are differences
And
in that area.
Right, and actually blindness is actually not a formal medical terminology, because it really is not precise. So it's really a little bit of a lay term. So when we talk about blindness, we need to be more specific, like using terms like legal blindness,
Right.
or loss of vision. Like vision impairment is also, again, a definition that's arbitrary, but the definition of vision impairment is anybody that sees less than 20/40, best corrected.
Okay.
So 20/40 is what the DMV likes to use as the parameter
Right.
for starting to ding you, right?
Right.
In terms of giving you that free and that's what he calls supervised license.
Oh, right.
Right.
Okay.
So you have to start getting like doctor's notes and different things when you are
Right.
20/40 or worse.
Okay.
So it's an arbitrary definition, but these are more specific definitions. So blindness is actually a very non-specific definition,
Okay.
and can mean a lot of different things depending on the context.
Okay.
Right.
Well, that was a lot of really good information. I'd like to ask you what would be your final take-home message to our audience today about what you, as in your specialty, would like them to know and be aware of.
Okay, well, let's start with the diabetic retinopathy. I think the take-home message, there's two take-home messages I would say for that.
Okay.
Number one, glucose control. I guess
Right.
number one, number two, number three, let's say, is glucose
Okay.
control. Because that's the one thing that patients have control of.
Right, you can't control age, but you can.
Right, you can't,
Control the other.
sometimes you can't even control whether you get the disease or not,
Right.
right? Get diabetes, but you can control the level of glucose.
Okay.
Somewhat.
Right.
So that would be my first take-home message. And the second one is to please be aware that if you have excellent vision, 20/20 vision, it's still possible to have very advanced changes going on in your eye. So
Yeah,
do
that
not
was-
rely on that as a parameter of, I don't need to see my eye doctor.
Okay, that is very good to
Right.
know.
Right, so annual screening exams are key.
Okay. And with the other diseases, or?
Let's talk about macular degeneration. So with the onset and the FDA approval of these anti-VEGF injections and the treatment of wet macular in the last 10 years, I think early detection is key.
Okay.
So again, going in to see your doctor, the earliest sign of any vision problems would be important to catch any wet changes early. And the signs of the wet changes are vision blurriness, waviness, or missing blank areas in your central vision.
Okay, so definitely if you have those
Right.
symptoms, go see somebody, but hopefully even before those occur.
Right.
Okay. And
Dry eyes, okay,
Yeah.
well, dry eyes, I think a lot of people think that they don't have dry eyes when they get tearing of their eyes. Tearing of the eye is actually a symptom of dry eyes. It doesn't make sense, seems a little counterintuitive,
yeah.
but the take-home message is that dry eyes can be very symptomatic, even though it doesn't seem like there's anything wrong with the eye per se, very symptomatic, very much affects quality of life. And so if you have tearing or fatigue of your eyes, achiness of your eyes, blurriness, or any scratchiness, those are dry eye symptoms. Go talk to your doctor about it.
okay, and then finally with the cataract.
I think
issue.
finally the last take-home message I'd really like to share with my audience is that no matter the vision impairment that you're experiencing, seeing the most frequent impediment I encounter that stops patients from experiencing the best quality of life is the commitment to their health and their eye health.
Okay.
Modern medicine certainly doesn't have all the answers and cures for any of these eye diseases that we talked about today. However, it is the daily work and struggle in the face of the vision problems that makes the difference. Don't give up.
Okay.
Fight to do the best with what you have. If it means going to a low vision specialist, do so. Loss of independence, depression, anger can be overwhelming factors to overcome. So struggle to find that solution around and through these obstacles.
So that was a lot of information. Thank you so much. If someone needs your type of care, how would they find you or get in touch with you and your practice?
Well,
Sorry.
my practice is called Advanced Retina Care, and I'm always happy to see somebody, and just call the office.
Okay, and hopefully we can provide that information on how to get in touch with you.
Sure.
So thank you for joining us today. We hope it has been informative, we hope it's been helpful, and that this will be the first of many programs. You can contact the show's producer with ideas and suggestions at blindsidefresno@gmail.com. We hope to see you again soon. Thank you so much for joining us on Blindside Fresno.